Good afternoon. My name is Lauren Harkrader. Today I will be talking to you about an interview that I did with a healthcare professional. For my interview, I interviewed an LPN. So an LPN is a licensed practical nurse. To obtain this degree, it takes about a year. Most LPNs get it from a community college. After obtaining the degree, they have to pass the NCLEX to be able to work as an LPN. They work under the registered nurse and the doctor. Their tasks vary from state to state, but most LPNs can administer medications, do simple procedures like starting IVs, inserting catheters, little things like that, and then also assisting patients with their daily living needs. So some background information on the LPN that I interviewed. She works in a doctor's office. She works at Forsyth Pediatrics, which it is very common for LPNs to work at a doctor's office. Many of them work in assisted living or nursing home facilities, also doctor's offices. Some work in the hospital, but it's not as many. She's worked here since 1994 to 2009 for 15 years. And then she started working here again in 2017 until now. So she's been there a total of 17 years. So in the position of an LPN at a doctor's office, she's able to assist with procedures, room patients, educate patients and their families about their illnesses, immunizations, any information that they might need. Also, starting and monitoring IV fluids. In the doctor's office, this is done to rehydrate people if they come in and they're severely dehydrated. Also, she can give immunizations and order and perform lab tests such as a flu test, a strep test, urine cultures. She can also do phlebotomy, so blood draws on patients. So a typical day at the doctor's office, she works 9 hours. They're open from 8 to 5. She will room patients, and rooming a patient consists of calling them back from the waiting room, getting their vital signs, taking them to their room, also updating any history, finding out why they're there, determining if there's any tests that they might need to run. Also assisting the doctors, so getting the doctors any equipment they might need, any sutures, also any paperwork that the doctor might need to sign or give to the family, triaging calls, performing well child visits, so such as annual visits and physicals, and giving immunizations. She can order, perform, and run certain lab tests, and this usually happens about 22 times a day. Each nurse typically has 22 patients. So for her, she feels like the most stressful part of her job is the phone triage, and the nurses here tend to, 2 nurses will be on the phones one day, then 2 nurses another day, and they have a rotation. So she says that triage on the phone is very stressful because you have to ask the right questions, you have to know what to ask, and you have to know if what they're telling you is true or not. So did this cough, really start 4 days ago, or did it just get bad today and the parents are really worried? So it can be hard to tell with pediatrics. Also knowing what to tell them, so should they come into the office or should they, take some over-the-counter medicine and come in a couple 24 to 48 hours. The area of nursing that she enjoys the most is elderly and Alzheimer's patients. She says that her favorite job has been at the Senior Services Center in Winston-Salem. And then when I asked her why she chose nursing, she said it was because her mom was a nurse. She was also a health insurance underwriter, and she really wanted to do the hands-on experience of the medical part, not just, behind the phones, behind the papers. And she also says that she really loves helping people and being around people and working with people. So thank you for listening today, and that is all.